Jamie has appointments with doctors, surgeries and specialists all over the city. Day in, day out. He's up with the latest medical developments. He's friendly with many of the doctors he sees. Now, let's meet Jamie. After years as a sales rep, Jamie was forced into early retirement by severe back pain. He now spends half of his time doing as he did in his career, visiting doctors. Cases like Jamie's are common. They're a likely result of years of incorrect manual handling practice. Manual handling is the everyday pushing, throwing, pulling, lifting, lowering and carrying that we do. Incorrect manual handling can cause both immediate and long-term strain and injury. The risk of injury increases greatly with high repetition, high force, long duration and sustained awkward postures. You can minimise the risk of pain and injury from manual handling. Simply stop, think and plan. Musculoskeletal disorders, or MSDs, are injuries that cause damage to the musculoskeletal system. MSDs result in short and long-term pain, depending on their type and severity. Sudden and uncontrolled actions can cause immediate and very painful strain and injury. But in cumulative strain and injury, pain is often absent until breaking point. An example of an immediate injury is a ligament strain. This is when a joint is pushed beyond its comfortable range. These strains can limit the everyday things we take for granted, like playing with the kids, doing the shopping, or a round of backyard cricket. A spinal disc injury occurs over time as the muscles are gradually strained beyond their limits. The tough outer wall of the disc cracks. The soft inner contents protrude and cause intense pain. Spinal disc injuries are debilitating. You can't sit through a film or travel or play basic sports. And life in the bedroom will suffer. Some back pain can be normal, but acute pain or pain that runs down through the arms and legs is a serious warning sign. Such pain should be reported immediately. This is the best way to prevent long-term damage. But of course, prevention is the best cure. Tight spaces and rushed housekeeping are a risky combination. If it feels awkward, then it's risky. CSL sales rep Lisa is getting organised. She uses equipment to minimise the risk. Jamie's taking his materials to the car in one trip, but this costs him time instead of saving it, and puts enormous strain on his body. Lisa's planned ahead. She sorted her materials into 2 trips and is transporting them safely to the car. Place materials in the boot of the car, not the back seat, as this twists your body. Remember to bend your knees to lift heavy objects and keep the load close to your body at all times.
Where's his turn off?
Yeah, hello. Hello, no problems. I'll be there in just a few minutes.
Just a second. Oh, hey.
Before driving, stop, think and plan. Prepare the car for the day. Long hours in a car increase the risk of lumbar problems. For optimum support, adjust the seat height and seat back. The seat back should be between 90 and 120 degrees. Pre-plan and double check your route before leaving. Turn off any distractions. Jamie's rushing is putting his body at continual risk. Lisa carries her load in 2 comfortable trips. Remember your lift and carrying technique. Bend the knees to lift heavy objects. And keep the load close to your body at all times. Wear sensible shoes with a sturdy grip. When you arrive at a meeting, take a few minutes to set up your laptop just as you would if you were at your desk with a regular keyboard and computer. Adjust the chair height so that your feet are flat on the floor, your legs are parallel to the floor, and your elbows are level with or slightly higher than the keyboard. Clean the monitor, then adjust its angle to minimize glare. If you stop, think and plan, you'll be relaxed and organized well into the future.